Or Dr. Paul Hutchison.
Thank you, Mr. Speaker. To the Minister of Health, what reports has he seen in relation to improving health services?
Well, Order, is that there was a specific issue, I think, missing from the question the member read out. I believe he left out the word frontline. And
Thank you, Mr. Speaker.
I invite the member to repeat his question.
What reports has he received in relation to improving frontline health services?
The Honourable Tony Ryle.
Thank you, Mr. Speaker. I'm pleased to inform the member and the House that I've received a report that New Zealand has seen the single biggest increase in the number of patients benefiting from elective surgery in any calendar year last year. In 2009, almost 135,000 patients received elective surgery, an increase of more than 12,000, or 10% on the number receiving elective surgery in 2008. This is a great reflection on our surgeons, nurses and dedicated staff throughout the New Zealand public health system who are working so assiduously to improve frontline services for New Zealand.
Dr. Paul Hutchison.
Thank you, Mr. Speaker. To the Minister, has this large increase in the number of people been achieved by delivering less complex elective operations?
The Honourable Tony Ryle.
No, Mr. Speaker, it has not. The advice I have received is that the average case weight, which is a measure of complexity, has remained unchanged. I can also advise the House that amongst the specialties that have seen more elective patients treated include cardiothoracic patients, up 18%, orthopaedic patients, up 9%, general surgery patients, up 6%, and patients needing plastics and burn surgery, up a remarkable 25%.
The Honourable Ruth Dyson.
How does this relate to the report just last week of 66 people waiting longer than the required 6 months for surgery in Timaru, which further says, the report further says, that as a punishment he has taken $450,000 off that district health board, and how will that cut help those people get their surgery quicker?
The Honourable Tony Ryle.
Mr. Speaker, when the news is that 12,000 extra patients got surgery last year than under the previous government, what I have to say to that member opposite is this government is providing more elective surgery for New Zealanders, and with respect to those 66 patients in Timaru, the one thing they know is that unlike the previous government, they won't be one of the 30,000 New Zealanders who were culled off hospital waiting lists under that government.
The Honourable Ruth Dyson. Order. I've called the Honourable Ruth Dyson.
How does this relate to the report last week of the Prime Minister being booed and called a traitor by a large crowd in Levin due to health cuts? The first time in living memory that a Prime Minister has been booed in Levin.
The Honourable Tony Ryle.
Mr. Speaker, although I just wonder and observe they're probably the same protesters who are making very good use of a billboard on the reverse side that said Darren Hughes for Otaki. Those billboards were not very effective in 2008, and I don't think they're going to be much more effective. What is effective are the representations of Nathan Guy, the MP for Otaki.
Dr. Paul Hutchison.
Thank you, Mr. Speaker. To the Minister of Health, what other initiatives is the government planning to improve access to elective surgery?
The Honourable Tony Ryle.
Mr. Speaker, it's very clear that one of the best ways to deliver more elective surgery is to separate out emergency surgery from elective surgery, because elective surgery is often stopped or cancelled when theatres are needed for emergencies. The government has already announced that it's building an elective centre at Green Lane. I can also advise that we are investigating a dedicated elective centre at North Shore and expect to make an announcement in relation to Hamilton at some time in the future.
Question number 5, Materia Tut.